scenario, if we're not able to bring them in, then we will just run with it, and maybe our media partners will be able to connect with Dr. Pryor and John Magus separately, and I can apologize and can help to coordinate that. So just 1 second. I can get this started, and then I can give them a call.
Can you hear my husband in the other room, or am I the only one who can hear him?
I can't, but I'll mute you just in case. All right, I believe that we are live. And so thank you all for joining us today. I can continue to have some technical difficulties. There's John. And so just welcome all of you back. It has been a while since we've had one of these types of press conferences where the City of Duluth, in addition to our community partners, provides an update to you, the public, of things that are happening within our organization, within our City of Duluth, and within St. Louis County. And so we thought that it would be helpful to reconvene this group and to be able to provide you with an update that would be helpful. So today, I'm hoping we have one speaker that I'm hoping that I can bring in the process. So we do have Mayor Larson from the City of Duluth. We have Dr. John Pryor, I'm hoping will join us soon. Dr. Van Deelen from St. Louis, thank you for being with us today. Amy Westbrook from St. Louis County, and then John Magus from ISD 709, who's their superintendent. So welcome. I do want to just remind everyone, we've gotten a couple of questions submitted from residents, but if you do have questions, we would love to have this be interactive so that if there are things that you are thinking about or have concerns about, that we can get you answers. And so if you do have questions, please send them to us by email at info@duluthmn.gov. Again, that's info@duluthmn.gov. If you do submit a Facebook question, we will get to you as soon as we can. However, if it's not a City of Duluth question, we may ask for some help from our friends. So that you know that, thank you again for being with us today and for dealing with our technical difficulties. We're trying to figure this out. So thank you for your patience. Mayor Larson, you are up first. And so thank you again. And I have got you unmuted. Thank you.
Okay, thank you, Kate. Hi, everybody. I'm having some hair difficulties as well, but we'll work that out. I do know that John Pryor is working to get in, and we have had some WebEx updates in the last couple of weeks, and so it's gotten a little more complicated while we do this first one. So just want to welcome everybody. Thank you for being here. At the beginning of this pandemic, we did these collaborative press conferences. I believe we started the first one in March, maybe March 16th or 17th, something like that, as a way to try to make it as simple as possible for everybody to get important information at the same time and in as much real time as possible. And so I thank the partners that are on the call with us today, the school districts, the county, St. Luke's, and Essentia Health. The city, we do not have a lot of announcements to make today, so my part will be fairly brief. I want to first just acknowledge that this is a really, really difficult time for people, and really everybody I know in the last couple of weeks, people I work with, people in my life, my family, my friends, everyone is feeling this intersection of 2020 and this year, and feeling it really acutely, whether it is worrying about family holidays and how are we going to do that, can we even do that, to just the stress of an election, to the reality that COVID cases are going up, to the daily experience many of us are having in terms of worrying about our aging parents and taking care of our school-age kids. Everyone is a little knocked off their feet. And so I just really want to start by acknowledging that that is real and that this is really hard. And you may have a lot of support, and you may have a job, and you may have your health, and it still gets to be hard. And that many of our neighbors don't have those things. And so we come to this conversation today recognizing that we're all doing our best, residents in the city and all of the community partners you're going to hear from today. We do know that the numbers are going up, and you'll hear about that. I think the communication to our community and to the state about COVID numbers has been really outstanding. Now it's what we do with some of that information. And so I do ask that you think about how you're moving through your neighborhood, your world, your family the next several weeks. We all want many of the same things, which is we want our kids to be going to school. We want our kids to be able to do activities. We want to be able to hug the people in our life who we love. And this year of sacrifice has been really hard, and we have more sacrifice ahead of us. And so just acknowledging that that is the case. A couple of quick just recap points. We do have this DEC testing facility. Vault is doing testing at the Duluth Entertainment Convention Center, the DEC. It's free. I encourage you to think about how you can utilize that testing site as part of your family and your workplace strategy. We know that testing is a good indicator of that day. It's not an indicator of before. It's not even a great indicator of a couple days from now, but it is one way to monitor where you are at in the course of a pandemic. And I just want to offer one thing that my family's doing. One of us is going and getting tested every week. And that's one of the things that we've decided as a way to just monitor where we are at. And so if one of us is positive. We live in a little house, so I would imagine it would be hard for us to not spread that to somebody else in our house. But at any rate, everyone has to find their own way through it. But whether you're a business owner and you're thinking of how to work shifts with your employees, whether people are in office or staying home, we have a testing site, and it's very convenient. I want to acknowledge that we have a lot of job seekers in the community. Our workforce development department is really outstanding and has a lot of resources that they can support you with. You can find that on our website, but also our workforce development has a great Facebook page. So I encourage you to do that. Also, there is, if you are a business owner and you're hiring, DEED, the Department of Employment and Economic Development, is launching a campaign with a hashtag #GoodJobsNow. So just a thought that you can kind of, get the word out that you are a place that's hiring. One reminder that we have started computer access at the downtown branch of the library by appointment. So we know that technology is a real barrier for people this year. And while we want to, be very careful about the health realities and risks that people are experiencing, we know that you need us as a library. So we are doing that. We are hoping and intending to also offer by appointment library browsing. We are not announcing that today. We are not ready to do that, but we are hearing you that that's a service you want. We did a snow removal reminder and everything we're doing with that. We spent a lot of time on that this week, but if you have questions about snow removal, go to our website, check out the press conference we did and the mini public forums where that was discussed. And then finally, it's election time. So you can vote in person in City Hall, and you can register same day in Minnesota. In person City Hall, you can vote between now and Saturday from 8 a.m. to 4:30 p.m. On Monday, you can vote 8 a.m. to 5 p.m. And then, of course, Tuesday is Election Day. So just we are seeing really unprecedented numbers of people voting. I think we're moving you through the facility safely. I know we are, and we're doing it really efficiently. But we are seeing really, like the other day, we had 500 people come in and vote in person in one day. That was a lot. So it's great. Keep it coming, and hang in there, everybody. We're all feeling it. So that's all from the city of Duluth for now, and passing it back to you, I think, Kate.
Thank you, Mayor. We're going to do just some shuffling. So Dr. Van Deelen, I hope you're okay with me putting you next. I am unmuting you, and you are all set.
Thanks, Kate. Thanks, Mayor Larson. I'm just going to pick up where Mayor Larson left off with some additional reminders, really health-focused reminders. This time of year, there's a lot to keep in mind when it comes to protecting your health and the health of others. Regarding the election coming up, it's really important that you follow the Minnesota Department of Health's safety guidelines for COVID-19. And if you didn't cast your ballot early and are voting in person, remember, try to avoid being in a large crowd. We know with these unprecedented numbers, that's difficult, but we know how important social distancing is. Wear your face masks. Again, one of the most powerful tools we have to protect ourselves. and wash or sanitize your hands thoroughly afterward. These steps really will go a long way to protect the health of everyone. Along with voting, this is also the time of year you should be getting your flu shot. This year, more than ever, is critical that you get your flu shot to protect yourself and those around you. Again, the symptoms of the flu are very similar to symptoms from COVID-19. And so the more respiratory illness we can prevent, the better off we'll all be. Flu shots are available through November at St. Luke's primary and urgent care clinics. Anyone can stop by to get one, or if preferred, call to schedule an appointment ahead of time. Plus, they're covered by almost all insurance plans and Medicare. With the change in our weather, which seems like it came way too early this year, we want to remind people that St. Luke's recently moved its drive-through testing site from Miller Creek Medical Clinic in Hermantown to St. Luke's Hospital in the former emergency department garage on First Street. That's downtown Duluth, so patients and staff can be indoors where it's warmer. St. Luke's Respiratory Clinic is still located at Miller Creek Medical Clinic in Hermantown, and that clinic is for people who have COVID-19 symptoms, acute respiratory issues, and need to be evaluated by a provider. St. Luke's drive-through garage at St. Luke's Hospital is for people who have either been exposed to someone with COVID-19 but do not have symptoms, or they have an order for a COVID-19 test at that location provided by their healthcare provider. St. Luke's drive-through garage at St. Luke's Hospital is open Monday through Friday, 8 a.m. to 4:30 p.m. No appointment is needed. Patients should pull up to the garage, remain in their vehicle, and wait for a staff member to open the garage door so they can drive in to be tested. And if you don't have a vehicle, you can walk up. If that's not convenient, as the mayor announced, the DEC testing site is a really great option as well. We want you to know that St. Luke's is safe to visit, both the clinic and the hospital setting, for all of your healthcare needs. We want to reassure you that if you have something bothering you or worrying you, you should come in and be checked out. Again, we've learned a lot since the beginning of this pandemic. We know how to keep you safe. We know how to keep our staff safe. We need you to avoid delays in care. It can create greater health concerns for you in the long run if you're delaying a visit to the hospital or to your clinic. We're doing everything possible to ensure your safety. If you're worried about coming in for care but still have a health concern, virtual visits are still an option that you might be more comfortable with. And scheduling, we have schedulers available to help you access care in that way as well. Finally, I want to share some information that might be important to you about patient transfers. This week, St. Luke's has been engaged in tabletop exercises with Community Memorial Hospital in Cloquet and also with Lakeview Hospital in Two Harbors regarding lateral patient transfers. A lateral transfer is when patients are moved between hospitals of comparable resources and capabilities. We want you to be aware that these transfers will only happen when it's appropriate for the patients being transferred and if there's an influx of patients at St. Luke's. If things become worse with COVID-19 and we end up having a greater number of patients in need of more serious treatment, moving patients who do not need as great a level of care will ensure that regional hospitals are collectively meeting the needs of everyone. We've had great partnership in that regard, and we know that St. Luke's has to remain a referral option for our critical access partners. In closing, on behalf of St. Luke's, I'd like to thank everyone for their commitment to ensuring the health and safety of their loved ones and others in our community. We know that we're heading into a holiday season, and we want to encourage you to celebrate all the positive moments that many of us have experienced during this pandemic. And sometimes it's hard to think about those, but many of us have had more meals at home with our families, sometimes more than we wish. We've been able to share virtual happy hours with friends. Some of us have been able to tackle a house project because we have a lot of time at home. And some of those experiences have been really positive. We know that the holidays will have to be different this year. Again, the masking and social distancing are really the best tools that we have available to us. And we hope you'll continue to do that and look forward to the next year or the next set of holidays when we can be together again in person. This region is so strong and has done such a great job. I think back to the spring and the incredible work that people did to protect themselves and their neighbors. And we know that we have to continue to do this. And with that, I'll turn it over to St. Louis County Director of Public Health, Amy Westbrook.
Thanks, Dr. Van Deelen. Amy, I'm going to unmute you, and if you could just turn your video on, you are all set.
Okay. Thank you, Dr. Van Deelen. Thank you, Kate, and thank you, Mayor Larson, for hosting this. This is an important time. We set a new record today in St. Louis County for our single largest increase in cases. Unfortunately, we had 115 new cases reported of COVID-19. And we also reported 3 new deaths, unfortunately. The number of deaths that we've had from COVID cumulatively have been 74. We currently have 21 people hospitalized, and 8 of those individuals are in the ICU. The last 2 months, I want to focus on the last 2 months because this is where we've really seen an increase in cases. And to give you some context, from March to August, we had in St. Louis County reported 947 cases of COVID-19. Since September, we've had 2,330, which is 70% of our cases in those 2 months. Less than 2 months because we're not done with October yet. And that is also replicated in our increase in serious cases. 61% of our deaths have occurred since September 1st, and almost 60% of our hospitalizations and individuals in ICU have also occurred since September. And for the last 10 days, there's been over 20 people hospitalized per day with COVID-19. So these last 2 months have been tough. March through August, we did a lot of great things. We need to keep it up. We need to slow the rate of spread for the health of our community, so we don't overrun our hospital systems. And the last 2 months, almost half of our cases have been the result of community transmission. So this means people are out in the community, they're getting it from either someone they know or someone that they don't know where they got it. So that's a 50-50 split of those who are getting it out in the community, and that's really troubling. So that means about 25% of people who are infected with COVID really do not know where they're getting it. And it's been a long 8 months. We need to take this seriously. It's not a time to let our guard down. And we're coming into the winter months, so we know that people are moving inside. It's so critical to wear those masks and to social distance. The highest risk of infection is when you're within 6 feet of someone. So that includes family, close extended family, friends, people outside of your household. And it's not easy. You know, we all want to gather. We all want to spend time with people that we haven't seen in the spring and summer. And, you know, our loved ones, we want to see them. We're doing a good job at wearing masks and social distancing out in our public places. In our grocery stores, we're doing a pretty good job. It's our small social gatherings where we're seeing a lot of our transmission happen. So even if you're gathering with extended family and friends indoors and you're not able to maintain that social distance, please wear a mask. Please social distance if that's possible, and really consider the risks and benefits when you are gathering with friends and family. And ask yourself, is going to a birthday party, can I wear a mask? And then really determine whether it's worth going to that birthday party and not wearing a mask, or not being able to social distance, or going and wearing a mask. So it takes all of us, and really those just making sure that those small gatherings, we're not letting our guard down. In the recent past, we've talked about colleges and universities. Since September 1st, we've seen 15% of our cases related to institutions of higher education, and most of those are linked to off-campus housing. We continue to see that as a problem. 15% of our cases since September have been associated with institutions of higher education. We need everyone to be vigilant. It's not enough to assume that if you catch it, you'll likely recover. We want people to think of their neighbors, their friends, neighbors and friends who are vulnerable, who have chronic conditions, our grandparents. Think of them when you're deciding on your health behaviors. Because if you catch COVID-19, you may not know when you become infectious. You may or may not be showing symptoms, and you may be infectious even without symptoms. So remember those vulnerable populations. We see community transmission increase, and the hospitalizations and deaths, the increase in hospitalizations and deaths follow. And that's what we're experiencing right now. We talk about wanting to return to normal life. Mayor Larson mentioned, wanting to keep our kids in school, wanting our businesses to thrive, wanting to have community sports occur. We all want that. There's a trade-off here. If we want to keep our community thriving, we really need to practice those good health behaviors of wearing face coverings, social distancing, staying home when you're sick, and washing your hands often. So, 74 of our residents have passed away from COVID-19. Normal, looks very different for those families. And so normal will not return for some of our residents. So please continue to take this virus seriously, and let's all do what we can to minimize the spread.
Thank you, Amy. Next up, we have John from ISD 709. John, you are, whoops, 1 second. John, there you are. Go ahead.
Sure. So I just want to thank you for having us as well. And as I'm just finishing up my 4th month as superintendent here in Duluth, I'm just really honored and humbled by the work that's done here. The sense of community, the sense of collective support that people have for one another is just really impressive. And I think that today's event is really a great example of this as well. It's hard to believe it's been even a little less than 4 months, because things are quite busy in education, of course, as they are in the medical fields and as they are in government as well. But we've been very dedicated to trying to provide the best possible instruction we can, despite the challenges that we have. And but the challenges that are brought by the pandemic are really huge, and our staff, our students, our families, we know that this is a huge challenge for everyone, and that there are losses of learning, that there are social emotional needs that are not met, and that there are things that we really want to do, and being able to be in person as soon as possible when things are safe enough to do so is really important to us. It's important to us all. I think also being able to continue those activities and athletics when we can safely do so, but stopping when we need to is important as well. So it's important that we think about those things that are weighing on our community. And one thing that I think about a lot is the American Association of Secondary School or of School Administrators. They estimate that tens of thousands of students will never return to school after this is over. And there's also another estimate that shows that up to 3 million students across the country have not engaged in any school-based learning since March. That's 3 million students. So the longer we have this continue and the longer we don't take care of the safety precautions that we need to, the more that's going to exacerbate the gaps that are already there. Because the students that are most affected by this, many students are affected, all students are affected, but the ones that are affected most tend to be students who already have opportunity gaps and some challenges as far as having access to learning. So we want to do everything we can here in Duluth and across the country to face these challenges. And again, that collective spirit of Duluth in making sure that we're getting things done is really important. When I came to Duluth a few months ago, I see Duluth as a hardworking, caring city, and I think that spirit is exactly what's going to help us in this situation. So we, within the public schools, within ISD 709, we're working day and night trying to seek new ways of teaching and better preparing our students, and also trying to serve people in better ways through distance learning and through our hybrid models. But we also know that many times there's frustration. There's frustration if we have to consider canceling sports. There's frustration if we're in distance learning versus hybrid, or if we're in hybrid versus full face-to-face. But we take the recommendations and the guidance that we're receiving from the Minnesota Department of Health and the local county very, very seriously, because it's important to really think about what we need to do to ensure that people are safe. I remember a quote from a parent that had written in and said that when this is over, we will be able to recover lost learning, but we won't be able to recover the lost lives. So being safe so that we can get back as soon as possible is really important to us. I would also say that as we're looking at the different things that we need to do, that we're very, very thankful for the Duluth community for following all the COVID protocols, for bringing numbers down, thinking about hand washing, thinking about mask wearing and social distancing and staying home when we're sick. Those are really, really important measures. Another thing that we don't always think about right away when we think about safety, though, is mental health. I think it's really important that we think about checking in on our family members and our kids. It's important that we check in with our loved ones, but also checking in with people we work with and our neighbors, and also check in with yourself, because as people are suffering and having these additional challenges, it's important that we're caring for them from a mental health perspective, and that we're providing the extra support and care that they may need in this situation. We have had a higher number of students having suicidal feelings or even suicidal attempts, and it's important for us to really think about how are we embracing those needs from a safety perspective, as well as a preventative mental health perspective. When we started talking about having a press conference like this, and I know that they were done in the spring as well, I also spoke with the superintendents from Superior, Hermantown, and Proctor, and they were going to be speaking with folks from their municipalities as well, because we realize that the interconnectedness of our communities is important as well. And so making sure that we're all thinking about this from a Twin Ports health perspective is really going to be critical. So again, in closing, we will continue to improve our work with distance learning. We're looking at more synchronous learning. We've ordered thousands of additional computers, which will be here soon, allowing for closer to one-to-one device for the 3rd grade through the 12th grade, as well as thinking about other supports that are going to make learning in this current situation more effective. We've also been engaging in a lot of professional learning, and we are deeply, deeply committed to making it the best it can be. So I'd like to thank the people who have been part of the conference today, the other districts, of course, but the city of Duluth, thinking about the other municipalities that are part of our district, as well as the state and local health officials. And I would also say that some of the people that I really want to thank most of all are our teachers and our other staff members and our administrators who are doing this work. But I especially want to thank our students and our parents who are backing us up and working hard and doing as much as possible to make sure that they're successful as well. Everybody's working hard. It's a challenge, but the hard work that I see being done really is lifting to the spirit as well when we think about how we're going to move forward. Thank you.
Thank you, John. And apologies, we were having some technical difficulties, so Dr. Pryor from Essentia is not with us today. However, we do have Louis St. George with us, who is able to provide his message. So Louis, you, I believe, are unmuted. Go ahead.
Thanks, Kate, and I apologize for a less than ideal Plan B on our behalf. As Kate alluded to, I'm Louis St. George, Media Relations Specialist at Essentia Health, and I am reading this on behalf of Dr. John Pryor, who is president of Essentia's East Market. And again, Dr. Pryor is immensely sorry he was unable to join us here today. We had some technical difficulties, and so while I'm no doctor, I'm gonna play one here for the next few minutes and just read Dr. Pryor's words. I wanted to thank Mayor Larson and her staff for putting this call together. We feel really fortunate to be in lockstep with so many of our community partners while working relentlessly to keep people safe from COVID-19. At Essentia, we are experiencing a high volume of inpatients. We've been inundated with patients who have delayed care, and they're now sicker than normal and have to be admitted because they didn't get that routine medical care. COVID cases are increasing as well, of course. And then we have the upcoming flu season. This is what I'm calling the perfect storm. So if you need preventive care like a colonoscopy, a mammogram, immunizations, or you have a chronic disease that requires follow-up, such as diabetes or hypertension, come and get evaluated. We want to see you in our clinics or virtually to prevent you from needing a future visit to the emergency department. I don't think it's any surprise that our capacity is stressed. We've talked about this before. However, we do have internal processes and surge plans in place to respond to fluctuations in our census and how many folks are admitted to our hospitals. We're always working on that. And those processes involve managing staff and resources, triaging patients as appropriate, and occasionally transporting patients between Essentia Health facilities. Dr. Pryor wanted to be crystal clear about this point. We are here for you. In our hospitals, in our clinics, we have the resources to treat you and provide the care you require. Similarly, please don't think twice about calling 911 or heading to the emergency room if the situation calls for it. We do have rigorous safeguards in place to protect our staff and patients, and these include limiting visitors, screening everyone, strict PPE requirements, robust cleaning and sanitization, social distancing, constant masking, and increased testing. We also are working to designate a wing strictly for COVID-19 in order to keep those patients isolated. We're 8 months into this pandemic, and honestly, we have a long winter ahead of us. It's essential that we take this virus seriously. Almost 230,000 Americans have died from COVID-19, but the negative ramifications go well beyond that sad yet growing number. Long-term respiratory defects, organ damage, and lingering symptoms like headaches and shortness of breath are impacting even young people following a COVID diagnosis. Hearts and lungs can be damaged extensively, even among those who had mild symptoms. And this raises the risk of things like heart failure or persistent breathing problems. COVID also is associated with a higher risk of strokes and seizures, again, even for young people. I'm reminded of a young man who spent nearly a month in a Minnesota ICU last spring. His name is Ben O'Donnell, and he almost lost his battle with COVID. He pulled through, but weakness and fatigue stuck with him for months. His lung capacity was decimated. And Ben O'Donnell is an Ironman athlete who competes in races that cover 140 miles of biking, running, and swimming. COVID can be very rough on anyone, as Ben's case illustrates. So you might survive this virus, but there's a reasonable chance that it will impact you for weeks, months, or even years to come. COVID's reach is pervasive. It's stressing hospital systems across the country. It's exacerbating a mental health crisis. It has ravaged our economy, and it's killed loved ones. Please take it seriously. Wear your mask so it covers your mouth and your nose. Practice social distancing. Wash your hands. Stay home if you have mild cold symptoms. And while I know we all have to do things like grocery shop, I'd encourage you to avoid public indoor settings whenever possible. If you have to be indoors, wear your mask and stay 6 feet away from others. Also, and again, Dr. Pryor couldn't stress this enough, get your flu shot. You don't want a compromised immune system during a viral pandemic. Visit essentiahealth.org and click on the Get Your Flu Shot button on the homepage for more information. And before I move on, I have a request. Whether due to the pandemic or politics or something else entirely, I feel like we're missing some of the compassion that weaves our communities together. So Dr. Pryor's request is simple. Be kind to one another. Be patient. We're all trying to make the best of a really stressful time, and we owe each other just a little bit of grace and understanding. Thank you.
Great. Thank you, Louie, for stepping in. I really appreciate it.
Kate, you're muted.
See all kinds of technical problems today. Happens to the best of us. Thank you, Amy. I wanted to make sure that we were able to get some of our questions from the media before we answer some of our questions from residents. So I do believe that our members from the media had asked a question by using our chat. Otherwise, if you can send me a text or just email me, I'm happy to pull your questions from there. So Emma, I will unmute you here in a second so that you can answer or ask your question. Emma, you are unmuted. Go ahead.
Yeah, I'm just curious to see what the hospital capacity looks like right now. Is there a strain on any resources? Any efforts to keep the staff fresh and updated? And just, is there any possibility of being overwhelmed with COVID patients at this time?
Great question. Dr. Van Deelen, is this something that you would be willing to take for us? You are unmuted. Go ahead, Dr. Van Deelen.
Sure, Kate. Emma, that's a great question. As Louie or Dr. Pryor alluded to, yeah, we have been running very high census now for about 2 months straight. And most of the patients that are admitted in the hospital are not COVID. And we do believe that delayed care has contributed significantly to the complex medical issues that patients are struggling with. But what we're seeing most recently, and really is a concerning but steady increase in our COVID patients on top of an already very busy hospital setting. So our staff are getting tired, and they are having community exposures where some of them are coming down with COVID. And so as many businesses I think are probably experiencing, we are challenged with staffing levels and maintaining those as people are placed into quarantine. We are constantly evaluating our census and other things that contribute to our census, like being able to perform elective surgeries. And we know those are very important to the patients of our region. We want to continue to be able to offer those procedures. And yet we know that that is one thing that we may have to address if the high census really persists and the COVID numbers continue to climb. We have fantastic staff at St. Luke's, and I can't say enough about the teamwork and the sacrifice that continues to go on. And they really need to again, know how valued they are by our community, and our community has been so good at doing that. But yeah, we're entering a really challenging phase, I think, that may last for a couple months, and that's why, as so many have already said today, we really need to use the tools that we have available to us. Masking, social distancing, and avoiding close groups, especially inside. That's how we decrease this steadily increasing community spread, and that's how we're going to avoid overwhelming the hospital systems.
Great, thank you, Dr. Van Dielen. Emma, hopefully that answered your question. Kelly, I know that you have a question. You are unmuted.
Awesome. Hi, thanks everyone. My question is about the DEC testing site. So I think this is probably for Amy. So what role does the relatively new DEC testing site play into our climbing case numbers?
Amy, are you able to answer that? You're unmuted.
Yeah. Oh, I am, okay. Well, to date, we've seen about 13,000 people utilizing the DEC. I guess about 13,000 tests run through the saliva testing site. It really expands our options for testing as a community. It has not, well, from my perspective, it has not affected our positivity rate in the county. We certainly are seeing more tests run because of the DEC site, but that doesn't sort of translate to more like a higher percentage of our residents having, COVID. We are still seeing our positivity rate grow above 5%, which is troubling. And we have seen a positivity rate from the Duluth site around last week was about 6%. So the benefits of having the saliva site are really increasing the options for people to go and get tested. It decreases barriers. It's an option. It's a non-clinical option. So people who are not interested or not wanting to go to clinical sites to be tested can go and get tested there. We do encourage people to seek out their clinical care at the healthcare systems for testing. Ideally, you're being tested by a clinician, so in case you need follow-up. But the DEC does offer a really nice complement to our testing opportunities. And that it also takes pressure off the healthcare systems and our laboratory capacity as a state. So we have seen multiple other sites across the state open, saliva testing sites open now. So we have had that operational for the last month or so, and now we're moving to a statewide system of the saliva testing sites, which is great.
Thank you so much, Amy. Just going to mute you. And I know that Mayor Larson had to step off. Katie, I know that you have a question for John. You are unmuted. Go ahead.
Hi, yes, thank you, everyone. My question is for Superintendent Magus. I'm just wondering if you could provide some clarity about kind of where the district is at with its extracurricular sports and other activities for secondary students. I know we've seen some other districts in the state, like Anoka-Hennepin recently, decided to continue with activities despite kind of having to switch learning models based on numbers they were seeing in their part of the state. So I guess my question would be, is if St. Louis County kind of passes that 30 bi-weekly case rate, would the district cancel its extracurriculars for sure, or is that something you're still figuring out?
Sure, I can comment on that. And there's the guidance continues to evolve on a regular basis. There was new guidance from the Minnesota Department of Education yesterday that talked about how we need to make sure that we're looking at things from a they were saying looking at it from more of a surgical close-up level as opposed to looking at just a county or just an area of schools, and that we should we should work with the team representatives we have from the Minnesota Department of Health to look at what are the community spread rates, what are the spread rates within the schools, and then also what kind of spread are we seeing potentially within our athletics and activities department. And I think that's where some of the districts have gone with their decision making, is when they're meeting with the Minnesota Department of Education or Department of Health and seeking guidance. If they are making a determination that they are in distance learning because they are required to be in distance learning because of those factors of community, school, and spread within athletics, then if it's a required distance learning, then they are to shut down their athletics and activities. If it is a selective choice of the district, if they're doing so and it's based on just trying to be preventative and trying to be on the safe side of things, then they are allowed to continue their athletics and activities, as well as one thing that I think is just as important as those athletics and activities are the targeted supports for students that we have, that our students who are struggling the most at secondary, we're bringing them in for in-person support. But it's important for us to be thoughtful about scaling that up as we have capacity to do so. But again, it comes down to, has the school and in conjunction with the or school district in conjunction with MDH determined whether or not it is a choice and that we're doing distance to be safe, or is it a required distance learning because of recommendation from MDE or MDH rather. We did request yesterday a meeting with the representatives from the Minnesota Department of Health to examine that, now that the number is above 30 for the county as well, and we're waiting to hear back. They may have responded in the past hour or two, but waiting to hear back so that we can schedule that meeting and have that conversation. As you note, Hermantown had similar conversation recently, and they elected to stay open because they were not seeing spread within their schools and they were not seeing spread within their athletic teams or activities. As of this point, with our athletics and activities, we have not had any instances of spread within the team. We've had some teammates that may have contracted more than one case together, but it was because they had relationship and friendship outside of the athletic events that caused. So we continue to monitor. We also have a meeting every Thursday at 4 o'clock with the Minnesota Department of Education, and quite often there's new guidance in that meeting. So we stay abreast and listen and try and make sure that we're making the best choice possible. It's one of the biggest challenges I've ever had as an educator, because the two primary goals of schools are to teach kids as well as possible and to keep kids safe. And here with the current situation, unfortunately, sometimes those are at odds against each other, and sometimes keeping students ultimately as safe as possible would mean that we're all in distance and that there's no activities, no athletics. But that also means that it's less engaging, and also sometimes there's contribution to other concerns there. So it's a careful walk that we try to make as thoughtfully as possible. And I'd like to thank Amy Westbrook in particular has been very, very helpful, as have Sarah Miller and others from the county.
Great, thank you, John. Armand, I know that you had a question for Dr. Van Deelen. So Armand, you are unmuted. Go ahead.
All right, thanks. Yeah, my question for you, Dr. Van Deelen. You mentioned people traveling for the holidays. Are there any extra recommendations or precautions you have for people who might be going to maybe a state with with a higher number of cases, and any quarantine required for those people when they come back?
Yeah, thanks for the question. It's really I guess my answer is going to be kind of difficult to hear, I think. The problem I think that we get into when we consider traveling right now is that we know there's a fair amount of asymptomatic spread of COVID-19, and we know that testing is just a snapshot in time. So I've heard some individuals talk about, well, I'm getting tested and then I'll go visit my grandparents. Or the problem is that it takes several days for a person who's exposed and has COVID to actually test positive reliably. And so I would say that the best way to be completely safe, both ourselves and keep our loved ones safe, is to celebrate remotely this holiday season. If that's not an option, and we know that for some it can't be, either due to health constraints or what have you, then I think you have to use the tools that we have available to us. You have to mask all the time. You have to maintain greater than a 6-foot distance between yourself and your loved one. That's awfully difficult since many of us haven't seen people special to us for months. And then I think there is a need to really, depending upon who we live with and who are around and their health issues, we need to, I think quarantining, if you can, really is good. Washing our hands with a hand sanitizer is really helpful. Again, it's really tough, especially 8 months into this. We're tired. We want to get back to normal. We are not able to get back to normal yet. So stay vigilant, protect yourself, protect those who you love, and hang in there for the next few months. Things will get better, and we persevere here in the Northland. But it's just really not a great environment to be traveling right now.
Thanks, Dr. Van Deelen. I do know that Alejandra from WDIO had a question that I believe, I'm hoping, actually maybe you or Amy can answer, but we'll start with you if you're able to. Her question is that, can I ask about the recovery rates or numbers and how they are looking? Wait, let me read this again. If they're, ask about how recovery rates or numbers are looking with COVID in Duluth or St. Louis County. A viewer had also asked if saliva testing is being offered at hospitals or is that just at the DEC? Can you take that one, Dr. Van Deelen?
Yeah, I think the vast majority of individuals with COVID-19 recover well. The problem, as Dr. Pryor alluded to, is that although we do know some individuals who are at high risk given underlying health conditions or advanced age, that's not reliable. And we do see some young people with no health problems really inexplicably become very ill with long-lasting symptoms. We are definitely seeing individuals where they have symptoms for weeks, even months. And so I think it's, when we hear about intensive care unit admissions, we know that in general, those numbers have diminished. People still are having really long-term effects that we're still working to understand. I think the other question, piece of the question was about testing. So we do not have saliva-based testing at St. Luke's. Again, we believe that the vault testing that's being done at the DEC is really a great resource for the community and really can help us prevent spread amongst our loved ones, our circle of friends, and at our work sites. we have looked into different testing platforms as a measure to try and decrease the turnaround from the time that a test is done to a result is available. But at this point, St. Luke's does not have a saliva-based testing platform.
Great, thank you, Dr. Van Deelen. I'm also, that was the last question that I had from the media. I did want to get a few of our resident questions that were submitted answered. So Dr. Van Deelen, I'm hoping that you would be able to answer this one as well. Tony had asked about our healthcare workers, EMTs, et cetera. This is her question. Protecting us from when they are out in their community. Are they required to wear masks and socially distance themselves from us? I'm concerned that some are not taking it seriously. Are they required to test for COVID-19 on a regular basis?
Yeah, that's a great question. We in the hospitals and also our emergency medical teams in the pre-hospital setting, we've learned a lot in the time of this pandemic, and we've been able to figure out how to protect ourselves. So what are the important pieces of personal protective equipment, PPE, that we have to use? We know how to sanitize our equipment. And because we don't know who has COVID and who doesn't, we are protecting ourselves in really every case currently. So for instance, in the hospital at St. Luke's, anybody who's doing a patient-facing activity wears a mask, a surgical mask, and a face shield. And that's just the foundation. And that's the same for EMS. And if there's a higher risk patient because of a particular type of a procedure, then we take the next step in PPE, which is a specialized type of a mask, or what we call a PAP or hood, which has a different sort of air source. So we don't test or endorse testing regularly of healthcare workers. We do it in particular exposed situations, but primarily because of the limitation around testing. It's just a snapshot in time. We don't really have the testing capacity to test everybody all the time. It would overwhelm the testing capacity and increase the turnaround time, and it really doesn't do what we want to do. We're protected, and since we are, you and the community are protected as well.
Great, thank you, Dr. Van Deelen. I'm going to give you a break, and I do recognize that we are about 2 minutes over our time. So our last question, I'm going to actually ask it for Amy Westbrook. Amy, I'll unmute you, but this is from Andrea. Andrea is asking, Amy, you mentioned that 15% of recent cases are linked to higher education. What is the population of college students or those connected to in Duluth? I assume it's not 15% of the population, but I'm not sure. So Amy, I'm not sure if you're up on population numbers or not. If not, maybe we can help and get an answer to Andrea later. But in case you want to take a stab with that, you're unmuted.
Okay. I don't know the exact population of our institutions of higher education in Duluth. UMD is definitely our largest, and so it's not a surprise that we see individuals associated with UMD being our largest population within that 15%. We did see cases increase dramatically among our 20 to 24-year-olds once college students started coming back, and our biggest place of exposure is really the off-campus setting. So it's that community transmission. So I can't answer. I don't know our exact population in our colleges or universities. But But I think in general, the colleges and universities are doing a great job with on-campus. We have seen very few cases associated with on-campus student housing or classroom spread, on-campus activities. It's really our off-campus environments, unfortunately. And we're working with the institutions of higher education to reach out to students. And so, yeah, I'm sorry I can't answer exactly what she was looking for.
No, that is okay. Thank you, Amy. Well, so again, I know that we are a little over our time today, but I think it's just important to point out that we haven't done this for a while. And so sometimes we have a lot to update and other times we don't have as much. So I did also want to point out that this is something that we are hoping to continue to do probably twice a month. And so look for additional information coming in the next couple of weeks of when we'll do this again. To all of our speakers today, thank you so much for taking the time. I know, again, we had some technical difficulties, so thank you for helping us get through those. To members of the public and the media, thank you for being with us. If you did leave a message on Facebook, we will do our best to be able to get to you if it pertains to the city of Duluth, and otherwise we might ask some of our friends to help us. So thank you again for being with us today, and have a great day.